Hi colleagues. Today, we'll begin our exploration of lumbar spine surgery, starting with patient positioning and moving through to the initial skin incision. Our approach combines techniques from neurosurgery tricks of the trade with the practical wisdom of experienced surgeons. Let's begin.
Under general anesthesia, the patient is placed prone on a Wilson frame. The spinal frame is used to increase the posterior gap between vertebrae. All bony prominences are well padded. Adequate care is necessary to avoid compression of the abdomen and thighs. The lumbar spine kept in the neutral position. A mark is made along the midline. After prepping and draping the patient's back in the usual sterile fashion. A localizing X-ray obtained after placing a needle marker along the level of interest. Following proper patient positioning and sterile preparation. Local anesthetic with epinephrine is injected into the skin and subcutaneous tissues to minimize bleeding. A midline skin incision is performed and centered over the disc space and I hope this explanation was helpful for everyone. I'd love to hear any feedback you have. Part 2 is coming soon. Goodbye for now and have a great day.